Thank you so much.
Okay. I'm Alice Mastrianni from the Children and Families Commission of Orange County. For those of you who are familiar with California, we have a proposition, a voter initiative, Proposition 10, that dedicated 50 cents of tobacco tax to ensure children are healthy, happy, ready to learn when they start school. That was approved by voters in 1998, and to me, it was a very firm commitment that early childhood is important, that perspective here in California. I've had over 40 years of health and human services planning in Orange County and Los Angeles County, so both at the city, county, nonprofit levels, and since I work for LA County, I'm going to say state level too, because that's as big as you can get. We are in Orange County, larger than 20-some states, and welcome to Orange County, by the way. And some of you may know us because of it's the happiest place in the world with Disneyland, or you're familiar with the Orange County Housewives. And maybe that's one perspective of Orange County, but I'd like to share with you a little bit different perspective. We have over 38,000 births a year. We have over 3 million people, 3.1 million people. We're one of the most densely populated areas in the United States. We have 25% of our population is children, 8% of that young children. And that's who I focus on, the prenatal to 5-year-old, to ensure they have the best start on life. And for our population, excuse me, for many years we've been monitoring the changing face of Orange County here. And currently for our young children, we're 47% Hispanic, 15% Asian, 3% Black, and the other 35% white and other populations. And so we no longer have a predominant white population, at least looking at our 0 to 5 and some of our changing demographics here in the state or in the county. One area I'd like to focus on too is poverty. When we've had foundations come to visit us, we typically take them off freeway and out of the Newport Beach, the Irvine area, and take them through our central Orange County to give them a very different perspective of what Orange County is really like. Recently, the federal government came out with the supplemental poverty measure. And in California, we have the highest rate of poverty among the 50 states, which is surprising for some people. But when you look at California, we have a challenge both in California and here locally in Orange County, is that statewide data really doesn't give us a good picture for planning of various regions and cities and counties in the state. Similarly, within Orange County, if you look at us in aggregate, some of our data, we look great, and that isn't so when you get to the level of community our families live in. So when we have a California poverty measure too, and when you look at the California poverty measure, we have the 4th highest poverty rate here in Orange County of the 41 counties and areas, data areas. And so that's a challenge for us to be able to really present that face when we're competing for, foundation funds or federal funds or state funds to be able to provide the resources and supports needed by our community organizations. We have, as the Children and Families Commission of Orange County, we fund about 250 programs. Last year, we served over 170,000 children, 18,000 family members, and over 15,000 providers for workforce development, training, quality improvement initiatives. So you can see from where I sit, we're not necessarily a provider, we're a funder of providers, and so it's very important for us to, as we're serving families, to understand the population, the organizations that we serve, and how they can best provide the needs for our families. Working with our First 5 Association across the state over the last 15 years, we've found that even though we're very diverse, small, medium, and large, and very diverse populations, there are some key things that families need that we all invest in, and that's newborn home visitation and an array of models to best meet the family needs, developmental and behavioral screening, and families certainly can access Part C services or educationally related services, but we need to be able to optimize the healthy development of those families and children in between. And I'll stop there.
Thanks so much, Alice. And I think your perspective is a great one for the committee as well. So we'll look forward to having some follow-up questions for you. Al, thank you so much for talking now about the work that you've been doing with Native American families.